basic, what is Medicare? It's a federally funded program for anybody who is getting ready to turn 65 or beyond 65. It can be for people who are under the age of 65 if they qualify due to certain medical disabilities, not to be confused with Medicaid, which is federally and state funded, going to be more for people who have limited resources. Where people get Medicare and Social Security confused, taking your Social Security benefit, you can do that whenever you decide, whenever you and your financial advisor feel that it's the best time for you to do that. Taking your Medicare benefits, your health insurance, we have to go through Social Security in order to enroll in Medicare. So the 4 different parts of Medicare, again, the alphabet soup that we talk about. A is all about your inpatient hospitalization. B is your outpatient medical. Part C is privatized Medicare. This is Medicare Advantage. And then Part D is prescription drug coverage. So we're going to talk about each of these individually. And as we go, we're going to fill in parts of this healthcare pie to give you an idea of what is going to be covered, but where are there still gaps? If you are approaching age 65 and if you do not have your Social Security benefits and you plan on going on to Medicare, you have to do that enrollment. If you are already receiving Social Security, the government knows you're turning 65. About 3 months ahead of your birth month, they're going to send you your Medicare card with A and B on it. Medicare Part A, for most people, if you or a spouse have worked long enough, then Part A should be premium free for you. Everybody is going to fall into one of these 3 different enrollment periods. The initial enrollment period is when you are approaching age 65. It's a 7-month window that starts 3 months ahead of time. It includes your birth month and goes 3 months after. If you are planning on going on Medicare when you turn 65, I highly recommend taking advantage of the 3 months ahead of time. It will make your life easier. Kind of all your ducks are in a row and everything starts when it needs to. Medicare is going to begin always on the first day of a month. Now, if you were born on the first day of a month, then you can actually start Medicare a month ahead of time. If you are admitted, that is going to kick in Part A, and it's going to initiate a benefit period of 60 days. In those first 60 days, Medicare is going to cover everything after the Part A deductible has been paid. Now, if you remain in the hospital beyond 60 days, now Medicare is going to cover everything but $408 for the next 30 days. And if you go in beyond that, then they leave behind $816. Now, the skilled nursing benefit here, this works on a 20-day benefit period. So as long as we're following Medicare's rules, Medicare is going to pick up 100% of the first 20 days at a skilled nursing facility. And they leave a little bit behind for the next 80 days. Now, if you're in consecutively beyond 100 days, well, that's where you're going to come in. But again, those 20 days, it's a benefit period, so it can start over. And this is how it's going to look in that healthcare pie. Now, Part B does have a premium. How they determine your premium is based on how you filed your taxes from 2 years earlier. So right now, they're looking at 2022. Part B is all about your outpatient, right? So this is your regular doctoring, specialist visits, therapies, durable medical equipment, ambulance services. I will tell you one thing. When you go on Medicare, if an ambulance is called for you, take the ride. If you don't get in and you shoo them away, then you're going to pay for that ambulance. If you want Medicare to jump on board, then get in, take the ride, give them your Medicare card. What are they not going to cover? They're not going to touch anything with routine dental, vision, hearing, foot care, nothing long-term care, anything that's alternative. You're on your own, right? Everything that Medicare is a part of has to have been put through the paces and approved. So this is how Part B is going to jump into that healthcare pie. So you'll notice there's still quite a few gaps in there that you might feel like you need to fill in. So now we've got Part C, which is Medicare Advantage. When you go on Medicare, you really have 2 options. One option would be to take A and B, original Medicare, and add a supplement or a Medigap plan and a drug plan. So A, B, a supplement, and a drug plan. Or another option would be to take all of that and kind of for ease to put it all into a ball and go with a Medicare Advantage plan. Okay, now it's a very simplified way of putting it, but we'll do a little bit of comparison here. In order to go onto an Advantage plan, first you do have to enroll in original Medicare. And then when you sign up with a company offering an Advantage plan, that company and that plan has now taken over. Okay, so it's now kind of taken the reins of original Medicare. So now it's provided by a private health insurance company. And with that, typically is going to come networks. Something that's very important to know, if you are looking for Advantage plans, they all have to be a part of what original Medicare would cover as medically necessary, but the structure of their plan, their outline of coverage, can be whatever they want it to be. So they can all be different. It's really important to make sure that you know what's being offered. What is a supplement going to do with A and B versus an Advantage plan? If If you decide to go with a supplement, then A and B, original Medicare, that is your primary, right? They are the ones, the analogy I like to use is like a tractor and a trailer approach. So if you go with A and B in a supplement, then A and B is your tractor, and they're the ones leading the way. And your supplement is the trailer, and it can't go anywhere unless the tractor's pulling it along. And then we got Part D, prescription drug coverage. Currently in the state of Wisconsin, there are 20 different drug plans that are offered in the state. They have rules that they have to follow. So every plan has to cover, at this time, a minimum of, I believe, 2 medications in every kind of medical category. And that can change every year. So this is one of those things that I can't stress enough how important it is to review your drug plan every year. So what are your options? A and B, again, it's an uncapped liability. So my guess is you probably want to get something that's going to give you a cap. You can stick with that original Medicare. You could pick up a supplement to go along with it and grab that trailer, okay, and hitch it onto the tractor. You could decide to go with an Advantage plan. There's something for everybody. If you go the supplemental route, you're probably going to want to pick up a standalone drug plan as well. There are a lot of companies out there, a lot of different options, and that's something that I would love the opportunity to sift through with you and make sure that we find a plan and a company that fits you and your medical needs and your financial needs. Again, thank you so much. I appreciate you all being here, and I look forward to talking to each and every one of you and helping you out with the process.